surrounding medium. No surrounding medium, like in outer space, you can't move. So when they have to move there, they take a gun and shoot. And the recoil of the gun makes you move the opposite direction. There are different types of locomotion. Walking, hopping, running, jumping, jogging, crawling. But out of that, walking is the one which is most economical. For a greater distance, if you want to travel and use minimal energy, walking is the mode of locomotion. Hopping is a very poor form of locomotion. But sometimes you require hopping and jogging are meant to spend energy when you are trying to lose weight. Running is the second best economical mode of locomotion. Only after walking. Running is only meant for speed. If you want to reach a destination faster, you should run so that you reach it earlier. Walking is a little slower than running.
Hopping, what happens is with hopping, we are become slower. In your childhood, you must have gone into that hopping races when that sack was put. That time you do hopping. But when a leopard does hopping, his speed increases, our speed, because we are two-legged, it reduces.
Here what you are seeing is, this is from childhood to old age. In childhood we are four-legged, then we become two-legged, and finally we become three-legged, we use a walking stick. Although this might seem evolution, it's actually our own life from childhood to old age. What you are seeing here is that the red color spots is a weight bearing area. Suppose you are 60 kg person and you are standing on 1 foot, the entire weight comes out on that foot. When it reaches the talus, it splits. 30 kg goes to the heel and 30 kg goes in front. In front there are 6 stones. 6. Actually the head of the first metatarsal has got 2 sesamoid bones, which are the weight bearing part. So that 30 kg in front is divided into 5, 5, 5, 5, 5, 5. 2 sesamoid bones carrying the 10 and the other 2 carry 5 each. This is when you are standing. The arch, anterior arch gets flattened. Whereas when your foot is off the ground, the weight bearing are the great toe and the little toe. That's why shown with a slightly bigger curve. So what you can see here, and what you can see of Yuvraj moving, when you take one step forward, the heel is the one which touches the ground first. And then, after it takes a step, the entire weight goes into that lower limb. If you are concentrating on the right side, the left goes off the ground, and then the right also leaves off the ground after the left touches the ground. When it touches the ground, it is called stance. When it leaves the ground, it is called swing. For the left limb is swinging. So we have got 2 clear phases, a stance phase and a swing phase when it comes to one walk cycle. What is a walk cycle? So there are some terms that are used. Advancement of 1 foot, that means the distance from right to left foot, how much here advance forward. It's called step length. Whereas striding is heel strike of 1 foot to the next heel strike of the same foot. That is called stride. Step length is the distance that you have traveled. Stride length is equal to 2 into step length. And stride width is the horizontal distance between the 2 feet. This is the diagram. Left limb is shown touching the ground from below. right leg is touching the ground next, and then again the left. From heel strike of left to the next heel strike of the left is called stride, which is equal to 2 steps. And when you are talking about step length, we are talking about the perpendicular distance between the heel strike. Don't take the oblique line. Cadence have number of steps that you walk per minute. Cadence differs from individual to individual. Each one of us has got a natural cadence. If you deliberately alter your cadence, you will get tired faster. Another movement which is called as mourner's gait, M-O-U-R-N-E-R, mourner. When you are carrying a dead body in the crematorium, you are walking with a group of people. Suppose you have a habit of traveling faster, then you will leave the group and want to follow the group. You know what you have to do? Don't try to change your cadence, because velocity is equal to cadence into stride length. What you have to do is reduce your stride length, don't change your cadence. Reduce your stride length, automatically your speed becomes slower and you are with the rest of the crowd. Okay? So, of course, if you are slower, you have to increase your stride length, don't change the cadence. So, that's the least thing that you can do as a respect to the dead person, which you could never respect him while he was alive. In the walking, there is a phase which is called as double stance phase. That means both the feet are touching the ground. This is double stance. And in running, there is no double stance, only one foot touches the ground. And before the other foot touches the ground, your left foot has raised up. That's in running. So in running, there is no double stance phase, there is a double swing phase, where your body is moving forward by its momentum in the air. There is a speed walking race that we have seen in the Olympics, where they walk quite fast. What they are doing is, they reduce the double stance phase, but there has to be a double stance period. If you go into double swing, trying to run a little faster, move a little faster, you are disqualified. So if you get a chance to take part in walking race, just walk your normal speed and assume that those who are in front of you get disqualified. What they do is video photograph the foot of the person. Moment double stand, the moment double swing occurs, disqualified. Okay? So this is the definition of a walk cycle. Walk cycle has two interpretations. One is the time interval or the sequence of movements. Both are called as walk cycle. Apart from the walk cycle, since it's a cycle, like a circle, you have to find out some point where you begin. So each cycle has been chosen arbitrarily as the beginning of our walk cycle.
So heel strike of this foot, so here the walking cycle starts from, this is just a step, and here it ends when the same foot does the heel strike.
So heel strike from one foot to the next heel strike of the same foot. That is a walk cycle. You can see the duration of stance here. Duration of stance is 60% of the walk cycle and the swing phase is 40%. Because there are 2 feet, both have got 60% stance. Automatically you can't have 120%. 20% is the overlap, which is called as double stance. And as I said in Olympic race, they try to reduce the period of double stand. So what they will have is stance of 51% and swing of 49%. So it is 2% as a double stand. If you reduce it to 50-50, touch and go, you may get disqualified. So stance is usually in ordinary walking is 60%. And since the walk cycle we have said starts from stand space to a heel strike, we will discuss the stand space first. Stand space is subdivided into early stand, mid stand, and late stand. And early stand is followed by loading response. Then your body weight is now shifting to that stance foot. And then late stand is further divided into pre-swing. Terminal stand is called pre-swing. When you touch after the heel strike, the foot does not go flat to the ground. It goes from the lateral border of the foot. Then it reaches the little toe, and then from little toe it moves to the great toe. You don't think that after the heel strike there is a snap of the foot on the ground. It gently goes forward via lateral border to the little toe and then to the great toe. That's why when you walk, there is hardly any sound produced, except of course you are walking on heels, tall shoes and walking, getting flat. However, walk very softly. But even then, some sound is definitely produced. And from the sound, at times you can even recognize a person. That's why that dialogue, हमारी कदमों की आहट से मैं तुम्हें जान गई हूँ. Next, let us discuss the stance space in three better things. Initial contact, heel strike, hip is 30-degree flexion, knee is extended but not locked. Quadriceps is the one which keeps the thigh, keeps the knee joint extended.
So, because your sir specifically mentioned that knee is extended but not locked. Now, when you stand in the dissection hall for a long time, body realizes that hamstrings cannot keep the knee extended, so the knee gets locked. Yesterday, you have learned locking.
Quadriceps.
So, quadriceps. So you have learned that quadriceps, they locked it. Now, here what is happening is during walking it doesn't get locked, and therefore because of excess walking running we do get pain here. Okay. Now what happens in a polio person?
Quadriceps is paralyzed. Let's assume that particular type of polio where quadriceps is paralyzed. Now you can't extend the knee. And knee cannot remain in extended position. Quadriceps is weakened. So what the person does, he keeps the hand as low on the thigh as possible, pushes the thigh behind, therefore the knee behind, hyperextend the knee. When you hyperextend the knee, it causes locking. So while walking, you will push the thigh back so the knee gets hyperextended and you get locked, then you can maintain the neck posture. Because you have to support the body weight on that particular lower limb when the other limb is going off the ground. So you have to walk with locking. Normally we don't walk with locking because we don't have time for hyperextension of the knee joint. Quadriceps keeps it extended. And ankle, in the heel strike, the ankle is dorsiflex. Then the ankle has to plantar flex to touch the toes. That plantar flexion of the ankle is done by gravity. So, it is a controlled dorsiflexus eccentric contraction, lengthening contraction is what makes the toes gradually touch the ground. Just remember, after heel strike when you are plantar flexing the foot, so the toes touch the ground, it is not done by plantar flexors, it is done by dorsiflex.
So something like gluteus maximus, we said that it helps for getting up from sitting position. While standing positions, it controls the movement. So here also when we do the heel strike, we feel that these plantar flexors may be doing this action. No, it is these which in a controlled way allow the foot to touch the ground. Okay, dorsiflex. So therefore in compartment syndrome, these are the muscles after excessive walking because they really get fatigued. They are used for this action as well as this action. And therefore these are the muscles which get easily fatigued and it leads to compartment syndrome.
When you are trying to shift the weight to the now supporting lower limb, it's called as loading response. You are loading the weight onto that. The knee is slightly flexed, it's already slightly flexed, and the ankle has now become plantar flexed by 15 degrees. Because it has started in the initial phase, now it is maintained in the position of 15 degrees. But what is important is the mid-stand space. In mid-stand space, the other limb is in swing. So the entire body weight comes out to the only single stand limb. The knee is extended in the mid-stand, quadriceps not locking. Ankle is dorsiflexed because your leg is moving forward. And the glute, and what is most important in this mid-stand is the role of gluteus medius and minimus. Gluteus medius and minimus acting from the greater trochanter pulls down the pelvis towards the supporting side, which shifts the center of gravity, center of mass of the body is at S2 vertebra. By pelvis tilting, the mass of S2 is shifted towards the supporting floor, and that makes the center of gravity pass through the only supporting limb. There is a little tilt of the pelvis. When this fails to occur, the abductor mechanism fails, then your pelvis will tilt on the unsupported side, which is what was described by Trendle and Burke. Now, if you tilt the pelvis on the unsupported side, your center of gravity shifts to the unsupported side, you will fall down. So to compensate that, the trunk will tilt towards the supporting side, so that the center of gravity is shifted. So when you are standing on the right lower limb and left lower limb is off the ground, the pelvis tilts to the right. If that fails to occur, trunk has to tilt to the right. Okay? Remember, trunk will tilt on the where the abductor mechanism has failed. It will swing to the right side of the right abductor mechanism failed, not to the left side. Terminal stance is when the hip is being extended and which is done by hamstrings. But if you are climbing upstairs and the body has to be lifted up, hamstrings are relatively quite weak. Now the gluteus maximus. So when you walk on level ground, it is hamstrings. When you take upstairs, that is gluteus maximus, which is otherwise doesn't come into play. You have to call powerful extension. So if you realize when you climb up the stairs, when you try to reach a mountain, a hilltop or a temple hill, next day you feel the pain in the gluteus. And because of continuous accumulation of lactic acid, which is not washed off by the blood supply because you're not accustomed to using gluteus medicine otherwise. The heel, next point is ankle. The heel rises in the terminal stance. Heel rises is a powerful anti-gravity movement produced by plantar flexors. Heel rises, powerful plantar flexion against gravity. Your whole body is being lifted up. So that is done by soleus followed by gastrocnemius. And then ankle is slightly plantar flexed because the heel is off the ground. Next point is you give a toe thrust. Next is called as pre-swing. The ankle is plantar flexed powerfully by flexor longus. So soleus is called as the first gear of a car. gastrocnemius is called as the fourth gear, and the flexor hallucis longus, the powerful muscle going to the great toe, is called as overdrive. So first gear, fourth gear, and top gear, fifth gear, overdrive. That's flexor hallucis longus. Remember, flexor hallucis longus, if you carefully dissected the sole, you will find that it gives two slips to the second toe and the third toe. Because these two, second toe and third toe along with great toe, are the one which gives the toe thrust. Fourth and fifth toe doesn't touch the ground, so you give great toe thrust. So flexor hallucis longus knows that flexor digitorum longus is quite weak. So it reinforces the tendons which are going to second and third toe, but they are also responsible for the fourth. So here what is see as the footprint, it start from the right to the left side. The right side you can see the heel touching. Second image from the right to left you are seeing that the lateral border of the foot is bearing weight, and then it shifts to the medial border, and then the heel is off, and then the toes are off. That's the image, the footprint you see on the ground. Next component is the swing plane. Early swing, mid swing, late swing. In the early swing, in fact, early swing, mid swing, late swing, the hip goes into flexion, flexion, flexion. The early swing, mid swing, late swing, knee joint initially is flexed, then it extends, and then finally it flexes again at the heel side. The ankle joint initially is plantar flex after the toe thrust, it goes into dorsiflexion. And this dorsiflexion is also done by dorsiflexor, goes against that. The mid stance and dorsiflexion is to make sure that the toes clear the ground. If there is foot drop, then the toes will drag against the ground. So what will happen is that you will try to take an extra high step to clear the toes of the ground. So in early swing, hip flexion, iliopsoas. Knee extension, knee flexion, hamstring. Ankle dorsiflexion is dorsiflexor. In the mid swing, hip is again flexed continuously, that's again iliopsoas. When the knee is extended, this is by quadriceps. Like the ankle is dorsiflex, which is by dorsiflex. And the late swing, hip is continuously being flexed. But now, in the initial flexion, iliopsoas mid flexion is also iliopsoas. Now the foot has got a momentum. If it is not decelerated, it will go on top. So you have to bring it back down to the ground. If terminal flexion is done by hamstrings to provide so that there is no excessive flexion. And this is also that action of paradox, which is active lengthening. It is actually decelerating the accelerating hip. The knee is neutral, right flexion, the ankle is neutral. No much room. Although we think that walking is mainly by the lower limbs, there are some other movements in the body also. Head bobbing. When you focus only on the head while walking, the head goes up and down. When you are on double stance swing, take a little extra long step. So head is at the lowest level. And when you take on a single swing, have a single stance, the head is at the highest level. Now remember, we all learned in physics, high ball is high potential energy, low ball, low potential energy. So highest position of the head, highest potential energy. Lower position of the head is the lowest potential energy, high kinetic energy. That's also sometimes asked in MCQ. Where does the body have got highest potential energy? Options: heel strike, double stance, toes flat, mid stance. So you should understand. That is the higher that. And besides, if you watch a person walking in front, focus only on his head, then there will be a swaying of the head 2 inches on either side. What are 2 inches up down? He also sways 2 inches on either side. And of course, if your body weight is excessive, shift of center of gravity is greater, the sway will be greater, and then you walk like Sanjay Dutt. Excessive swing. That was when you really know that. You have around 4 inches swing. Upper limb has got also movement. We tend to think when your left lower limb moves forward, the right upper limb moves forward, crossed. Why does it happen? Our body is economical, it cannot waste its energy, right? But probably this upper limb movement occurs because evolutionary dogs and horses can trot. They walk cross-legged, right? So maybe that same synapse is retained in evolution. That was the upper limb swing, unnecessary.
Only people who take their left leg and left hand together are those who cannot do parade on 15th August.
Another theory which says that why should upper limb move? So you can't expect that same evolution has brought the upper limb movement unnecessarily. In fact, if you try to keep the upper limb stiff, that is possible voluntarily, but you will spend more energy by not moving the upper limb. Then another theory is called as a spiralization. In the right lower limb moves forward and left upper limb moves forward. The body is spiralized. And spiral rope is stronger than loose strand. With spiralization, then increases the stability of the body. That's again a theory. Evolutionary theory. We have got upper limb movement, which is already there. And then it went to the quadruped, which was started now walking like, trotting like you. But probably the most important thing is maintenance of stability. Let's try to understand. We say when the left lower limb moves forward, the right upper limb moves forward. That is not the case. When the left lower limb moves forwards, the left upper limb moves backwards. Now, when the left lower limb moves forward, the center of gravity is shifted in front. And before that foot has gone into his strike, you will require some stability. So the upper limb moves backwards. Then there is some excessive movement forward and fall in front does not occur while the hand going backwards. So it is actually when left lower limb moves forwards, left upper limb moves backwards. And once the foot has reached the ground, then the upper limb comes back to the original position and by sheer momentum it is taken forward. So the backward movement of upper limb is active. The forward movement is gravity and its momentum. Okay, now if you carry a heavy suitcase in your hand, the upper limb will still sway but to a much lesser extent. Why? Because the suitcase is carrying a large load in it, which is slightly taken backward is enough force of it. So the upper limb will move as much as is required for the stability. Excellent.
We can move to next.
Any abnormal gait is called as a limp. It can extend from anywhere from a tight shoe to a tight person.
Right person मतलब
did not say this.
Tandem walking is walking in a straight line. We don't usually walk in a straight line. Our left foot on the left, curl on the left side, right curl on the right side, slightly. So tandem walking is walking exactly in a straight line. That happens when the adductors of the lower limb have gone into slight spasm. The adductors of the lower limb have gone into slight spasm. Instead of the foot touching where it should touch, it moves a little towards the inside. And the right limb also moves towards it. There is a spasm of the adductor muscles to some extent. If the spasm is excessive, then there will be a right lower limb has the imprint on the left side and the left lower limb has the imprint on the right side. This is called as scissors gait. Tandem walking, scissors gait are the degree of spasm of the adductor muscles. Remember, if you see the footprint and you find that there is a child who is having a cross-legged scissors gait, you are just seeing the footprint. You know that some child with cerebral palsy must have walked by. Before you do that diagnosis, make sure that the child has worn the correct shoe on the correct feet. If it is the other way around, don't just diagnose cerebral palsy. Remember, if you make a rare diagnosis, you will be rarely correct. Hemiplegics don't walk. But when they are recovering from it, they start walking. And when they start walking in hemiplegia, the hip flexors are very weak. Iliopsoas are the last to recover. So if you want to move that hemiplegic lower limb forward, what he has to do is, he has to extend the lower limb, abduct the lower limb, and then adduct. That's called a circumduction. So the lower limb moves forward by circumduction. And then hemiplegic is recovery. Spastic we just discussed about the scissors gait.
Spastic is the scissors gait because the adductors are in spasm. So this goes like this, then the next it goes like this. This happens classically in cerebral palsy.
So what you do is that isn't it distressing and the person tends to cross his leg even in the fall actually.
Which nerve will you cut?
Cut the supply the adductors. You get the
Obturator.
where is the obturator situated? Highway. It is in front and behind the adductors. Anterior division in front of adductors, posterior division behind it. So you palpate the adductor longus, go deeper to adductor longus and cut the anterior division. Don't cut both the divisions. The anterior division. So it is part of the muscle get paralyzed. So the adductors have the spasm reduces. Automatically the cross-legged is also reduced. At times you may require to cut the other one also. But don't worry, peripheral nerves which are cut also get healed. Hopefully after healing, there won't be that much of spasm. Anyhow, shuffling means you are not taking your lower limb off the ground. You are walking with a shuffle. The classical lifting of lower limb sweep way, then you are actually dragging your feet forward. That's what shuffling classically seen in Parkinson's case. What is there? When the head and the thumbs are bent forward, he is trying to catch his center of gravity and therefore he moves. And this movement is a little faster than ordinary walk. It is actually seen to be running. It is easier to run because running is done by cerebral cortex. Walking is done at the subcortical level. You can talk to a person comfortably when you are walking and you are walking from say Bombay Central to college, you have two of you together. You walk, talk, and suddenly there is reached. You will also walk from Baikar also. I feel for the shared taxi, you started walking lesser and lesser. And people are nowadays not even climbing stairs. Of course, this is fourth floor. Here, fifth floor is actually 7.5 floors. Because each floor is 15 feet high. And I go, do you feel you climb to be fine? So, still the ability to run is faster better than walking because cortical movement is easier in Parkinson's. Subcortical movement is only that.
And another most important thing is the automatic associated movements are stopped. Therefore, normally the hand moves. So in Parkinson, classically, you will never see a hand move. The person will be walking like this.
Because he is walking with the help of cortex. Hand movement is subcortical. The subcortical movements are all of them. First step of walking is cortical. After that, the walking becomes automatic.
Then you cannot stop also.
Stopping also is difficult. And restarting is again. Feet are planted wide apart, cerebral ataxia. Because of imbalance, you try to take a broader base. Broad base means you can easily support the body somewhere in between the base. Broad base. The person sways from side to side and he will even walk. If you ask the person to walk with the eyes closed, he will turn towards the side of the cerebellum affected. So when you want to find out which side the cerebellum is affected, ask him to close the eyes or tie his eyes, ask him to walk straight. He thinks he is walking straight, actually is taking the circular path. And that towards the direction in which he is taking a circular path is the direction of cerebral gait and drunkard's gait appear the same. But the main difference is to find out whether it's cerebellum or he has drunk, that's why. In cerebellum, the swaying will occur from side to side. In a drunkard, it will occur from front to back. The person is acting like he is cerebellum problem. You find that he is moving front to back, he has drunk. Cerebellum will sway side to side. In a drunkard, cerebellum is affected, but both cerebellum are equally affected. So it sway neither to the either side. Compass gait is a type of cerebral gait, as you said. You will move along a circular path, like a compass. Next, sensory ataxic gait. When you can't feel the sensation of the soul. Tabes dorsalis, that's a type of tertiary simplicity. Peripheral neuropathy. All these things you can't feel the ground. If you can't feel the ground, what you have to do is hear the foot hitting the ground. You take a higher step and stamp the ground. And high stepping and stamping. This is sensory loss. Okay, so you are hearing the sound because the foot has touched the ground. Otherwise you can't feel. You still feel you are walking on clouds. You can't feel the sensation.
Sensations of the lower limb are not there for him. So he is absolutely walking on faith of his eyes. इधर नीचे का उसका sensation ही नहीं है. So आवाज, then he understands that my foot has touched. Otherwise he cannot feel that.
So the point to remember here is that we tend to look ahead when you are walking. You don't look at the ground where you are going to take the next step. So he said, we walk on faith. The ground is there. And sensory affected person, he has to see where he is going. He has to hear the sound of the foot and he has to see, yes, the foot has hit the ground.
Something the way you will walk if you go to your village and they tell you that you're walking in the night and they tell you there is a snake around. How will you walk?
You should use that, what do you say, eyes when you're walking on puddles of water in Mumbai. You never know where there's an open manhole. Don't walk with faith when it's flooded. In contrast, if you have got foot drop, there is a chance that the toes will rub against the ground. So what you tend to do to prevent the toes from rubbing against the ground, you take a high steppage. So purely high steppage without stamping is foot drop. High steppage with stamping is sensory loss. Sensory loss is usually occurring on both the lower limbs together in neuropathies and other things. So
This is on the most one side only. Most
both
of
the
the
lower limbs.
foot drop.
Foot drop usually occurs only on one side. So high steppage is only one side without the need for stamping because sensory is not affected. When there is chorea, it's a condition where caudate nucleus of the brain is affected. Chorea is a Japanese word for dancing.
So basically he has abnormal movements. So आपको लगेगा कि वो stage पे कुछ ऐसा is performing. This is how he is.
Hysterical gait. This is to attract attention of the people around. And this person tends to feel that he is falling. But notice, he will never actually fall. He will fall exactly where there is a chair. He does not hurt himself or herself. See that the word has come from visceral, which means uterus. Hysteria was usually seen in, how to say, females who have no sense of responsibility. They are not taught. They don't go to schools and such people. Now they want to attract attention of the people. So they say they do hysterical acts. So it is said when the uterus wanders around the abdomen, wanders, that's the time when you get hysteria. So what is the best way to prevent it from wandering? Fix it together by pregnancy. When there is pregnancy, the female now feels responsible. That she should give birth to a child, which no male has ever done. The hysteria disappears. But now the uterus does not, actually does not wander. Analysis of the abductor mechanism. Analysis of the abductor mechanism of the lower limb. Will make the trunk tilt towards the affected side to prevent the center of gravity from shifting. So when it sways on both the sides, both abductor mechanisms are affected. It's called waddling gait. When it is sitting only on one side, it is lurching gait. Now, what is failure of abductor mechanism? Abductor mechanism is a hip joint, which is called fulcrum, neck of femur, which is called lever, power of abductor is called power. So there is a fulcrum, there is a lever and a power. All three can be affected. Arthritis of hip joint, that's a fulcrum involvement, which is unilateral. In contrast, congenital dislocation of hip is bilateral. Fracture of neck of femur is unilateral. Coxa vara, coxa varca is bilateral. Faulty intramuscular injection is unilateral, unless you go to the same GP who has the other way also. Unilateral. Whereas myopathies, where there is proximal weakness, is bilateral. So you have seen 6 conditions, 3 unilateral, 3 bilateral of the fulcrum, lever and power. If it is unilateral, you have lurching gait, tilting only towards the affected side. If it is bilateral, you will waddle both sides. A duck has got a heavier body, and a weaker legs. So when his one limb is on the ground, meant for swimming, so it's outside the pond, when it tries to walk. When one limb is on the ground, the body will tilt towards that side. Center of gravity and all the body weight is too high, and other limb.
Like a duck जैसा वो.
It also happens in overweight people when the legs become weak. Then you have to what? Myotonic gait, here what happens is the muscle goes into contraction but fails to relax. So that is the spasm of muscle which gives a tonic break and then movement. So it's not a smooth movement. Next. Antalgic gait. Algos means pain. And algos means absence of pain. So the lower limb is painful. You want to remote movement where the pain becomes minimal. So what is that? Is that the other lower limb goes into a faster swing. The other lower limb goes into a faster swing. The stance of the painful limb is reduced. So when you see a person walking slightly, one swing faster than the other, it appears that that swing which is faster is something wrong. You don't walk that way. You feel that the other limb is the one which is affected. Remember, the faster swing appears affected and it's because the other limb is painful. Just don't give a diagnosis. I think something is wrong with the right one. It might be actually painful left. And if you are giving the person walking, don't give a person the walking stick, he will tilt the trunk towards the affected side. Why? So that the abductor mechanism does not go into powerful contraction. Abductor powerful contraction is adding the weight to the lower limb besides the body weight itself. Tilting the trunk, the abductor mechanism stops. At least the abductor powerful contraction does not cause the lower limb to be more bent. Only body weight has to be more. And you give him the person walking stick, you will also use the walking stick on the painful side. Upper limb is not affected, lower limb is affected. So that the center of gravity did not shift much. You are already giving him the support. Nursing care you already said, unilateral failure of abductor mechanism. There is an intermittent claudication gait. The person walks normally, then he gets painful lower limb, then he goes and sits. Then he rests for some time, blood supply to the lower limb and come back, he walks again. And then he goes and sits. This usually happens when you are extremely tired and you are climbing up a hill. In enthusiasm, you started off very fast. Now you are fatigue. Every milestone that you get on the road, you go and sit. As the pain further increases, the claudication distance becomes smaller and smaller till it reaches so much of lack of blood supply is that you get pain even on resting. Pain on rest in claudication is usually called as the cry of the dying nerves. Muscles are already dying, now the nerves are also dying. Okay? This usually happens in smokers. Claudication. Next. Praxis is performance of practiced movements. Apraxia is absence of performing practice movement. Walking is the most practiced movement. If you forget that, you get apraxia of gait. Usually in frontal lobe. He's literally forgotten how to walk.
Gajni.
He starts thinking how to walk, hops forwards, crawls forward, etc. He has forgotten that it's the woman who always is so activity.
Next. ये मैं दिखाने वाला नहीं. Next. Thank you so much. बजाओ बजाओ ताली बजाओ